Thank you. I will now introduce our witnesses. Senator Bill Frist is a former United States Senate Majority Leader and doctor from Tennessee. Dr. Mark Hyman is founder of the Institute for Functional Health. Dr. Ann Peters is a senior scholar with the University of Southern California. Dr. Reinino is Chief Clinical Innovation Officer at SCANS Health Plan. And Dr. Ashley Gerhard is the Professor of Psychology for Food and Addiction Science and Treatment at the University of Michigan. Again, thank all of you for joining us today. Your written statements will be made part of the recorded record, and each of you will have 5 minutes to deliver your remarks. I might be a little more generous with that today, but try to keep it somewhat in the ballpark. And Senator Frist, if you're ready, you can begin.
Thank you, Chairman Buchanan, Ranking Member Doggett, and distinguished members of the committee. Having spent many more than 1,000 hours on that side of the dais, I'm truly grateful for the opportunity to be with you today to share my thoughts and my experiences as a physician, as a policymaker like each of you, and as a business person looking at innovative places to invest and approach this really challenging issue of food and nutrition. I've personally written tens of thousands of prescriptions for treatment and for prevention of disease, literally with my hands, but I've never written a prescription for food. But that's really about to change. I know it's about to change. And here I'm to talk a little bit why. And it's because nutritious foods are now recognized as being fundamental to prevention of disease, to the treatment of disease, to improving health, and to lowering cost. And as the chairman mentioned in one of the articles I wrote, it's really because it's fundamental, and we're going not to just treating the symptoms of a problem, of a challenge, the disease burden in this country, but to a fundamental root cause of disease. I've got 3 points really to make. First, the opportunity. Poor diets are the leading risk factor for death and disability in the United States, causing more health harms than tobacco use, than alcohol, than opioids, than physical inactivity or air pollution. Americans of all incomes, races and ethnicities, in all political parties, in every state, in every city, are affected. But in particular, those with lower incomes, living in rural communities, and from historically marginalized groups, face the greatest burdens, and they fall further and further behind due to these out-of-pocket expenses, to lost wages, to lost jobs, to depleted communities. The nutrition problem really is not complicated. Americans eat first too much refined starch, sugar, and salt, often as a part of the foods, as the ranking member just mentioned, processed far beyond their natural forms, and 2, not enough fruits, vegetables, beans, nuts, whole grains, seafood, and yogurt, which we know, scientifically know, promote health and protect against disease. Poor nutrition, as was pointed out, is crushing our economy. The numbers: the U.S. economy loses an estimated $1.1 trillion each year in direct medical costs and productivity losses due to poor nutrition, and it has the impact of increasing the federal deficit and thus the federal debt. As the chairman mentioned, poor nutrition is a national security issue. Nearly 8 in 10 young Americans do not qualify, 8 in 10 today, for military service. By far, the #1 disqualifier is overweight and obesity. Second point, food is medicine. What is it? What is that power itself? Food as medicine refers to a set of food-based nutrient interventions, active interventions, integrated into healthcare, and that's where the failure lies. It is not integrated today into healthcare to treat and manage specific disease conditions like diabetes and like high-risk pregnancy and heart failure, my specialty of the heart, chronic kidney disease, and cancer. We need to keep it clear in our mind, it's not just about prevention, it's about medical therapy itself, and I think you'll hear more about that from the other witnesses. The food as medicine programs include, what are they? They include treatment with medically tailored meals. Medically tailored meals, those are meals that are specifically tailored for very specific conditions. Again, more to come on that. It includes medically tailored groceries, produce prescriptions covered by health insurance, nutrition coaching and culinary education, medical nutrition education for doctors. Again, this isn't a social program or another way of doing assistance. This is prevention, and it is therapy. The demonstrated, proven benefits include less food insecurity, more healthy food intake, better health, including lower blood sugar levels, lower blood pressure, and body weight. They make financial sense. Compared to other common medical interventions, these food as medicine programs are either a healthcare sort of best buy, or they actually lower cost saving. For example, research from Tufts University estimates that about 6 million Americans qualify for medically tailored meals, and providing this treatment to these patients will save nearly $14 billion annually. Third, the policy implications, and I've outlined in my testimony policy implications that I hope that you'll consider specific for this committee, and also in that written statement, what other committees might consider as well. In closing, the food we eat, really as directly as anything that I've seen in my 25 years of practicing healthcare and 12 years in policy, directly and powerfully impact our health, directly and powerfully impact our economy. It hits at the root cause. They improve health, prevent disease, enhance well-being, save money for the individual, save money for the employer, save money for the community, and save money for the nation. Thank you, Mr. Chairman.
Yeah.